The U.S. Preventative Services Task Force has issued a 2016 recommendation statement for pelvic exam screening in healthy women. ABC 7's Alex Redmond joins us with more. Alex.
Thanks, Haley. Across various organizations, guidelines range from recommending against screening pelvic examinations to performing them manually. But this is the first time the Preventive Services Task Force has turned their attention to pelvic examinations. As a nurse and a woman, Buffy Benoit feels strongly about annual pelvic exams.
Absolutely. I mean, how do you know that something this year in between this year and next year doesn't pop up?
If you're a woman for years, this is what you would expect during a routine annual gynecologic physical. Now the U.S. Preventive Services Task Force says there isn't evidence that routine pelvic exams are necessary for prolonging a woman's life. Benoit says young sexually active women should have pelvic exams.
Whether it includes a pap smear or not, you should be having one yearly so that a doctor is looking at you.
There are probably instances where a pelvic exam isn't necessary, and there are times in my practice where I don't conduct a routine pelvic exam for a patient who doesn't have any complaints.
Dr. Gary Easterling of Gulf Coast Obstetrics and Gynecology says his concern is patients may not fully understand the recommendation statement.
For instance, when we had our new pap smear guidelines, patients started not showing up at the gynecologist, so there was no well-woman exam.
No opportunity, says Dr. Easterling, to discuss with patients what's going on in their lives and their health history.
Patients stopped getting mammograms, patients stopped getting colonoscopies and all that stuff because, I don't need to see my doctor now for 3 years or whatever it was, depending upon those guidelines.
The task force, a panel of experts in preventative and primary care, declared the current evidence insufficient to assess the balance of benefits and harms of the pelvic exam. And this is not the first time routine pelvic exams have been called into question. The American College of Physicians' 2014 recommendations were against performing screening pelvic examinations in asymptomatic, non-pregnant adult women.
I don't want women thinking they shouldn't come in for an annual examination. Whether or not that annual examination includes a pelvic exam, I think is up to the doctor and the patient after a discussion about the positives and the negatives.
It could be embarrassing, it could be uncomfortable, but I'd rather have a couple of minutes of uncomfortable rather than losing my life because I didn't have an exam because it would be uncomfortable.
And if you would like to share your views with the U.S. Preventive Services Task Force, this is your opportunity. You can post your comments on their website, and we already have a link for you at mysuncoast.com. Back to you, Haley.